Hello, everybody. Welcome to Wellness Wednesday. My name is Michelle Clegg, and I am your manager of whole health here at the Centers of Wellness for Urban Women. And today, during Wellness Wednesday, we are going to be talking about women's heart health. Why are we talking about women's heart health? Well, because February is American Heart Month. American Heart Month was created in 1964 with a proclamation from President Lyndon B. Johnson, and it aims to raise awareness about heart health and ways that we can prevent cardiovascular disease. So, what exactly is cardiovascular disease or CVD? So, cardiovascular disease is a group of diseases that affect your heart and blood vessels. This includes things like heart disease, heart attacks, strokes, arrhythmia or irregular heartbeat, heart failure, and heart valve problems. The risk factors for cardiovascular disease fall into two categories. So the first are those things that we can't change or things that we call non-modifiable. Those are things like your age, gender, or race, as well as your family history. Other risk factors we do have a little bit of control over, so they're called modifiable risk factors. These include high blood pressure, high cholesterol, smoking, type 2 diabetes, obesity, physical inactivity, poor nutrition, and chronic stress. So the question becomes, who is most affected by cardiovascular diseases? And the short answer is pretty much everybody. Cardiovascular diseases are the number one cause of death globally. They're the number one cause of death here in the United States. They're the number one cause of death for men. They're the number one cause of death for women. And they are the number one cause of death for people in most racial and ethnic groups. So even though CVD affects all of these groups, there are still health disparities with marginalized groups bearing the greatest burden of these diseases. For example, women. 1 in 3 deaths of women are attributed to cardiovascular disease. CVD kills more women than all forms of cancer combined. Yes, I'm going to repeat that. Cardiovascular disease kills more women than all forms of cancer combined. So among women 20 years and older, nearly 45% are living with some form of cardiovascular disease. Women are also more likely to die if they have a heart attack or stroke than men are. Women are also often less likely to receive bystander CPR or CPR from people in public if they were to have some sort of incident. This is usually due to many bystanders fearing accusations of inappropriate touching, or they may fear hurting the woman. Also, only 38% of participants in clinical cardiovascular trials are women. So that's a huge gap in understanding how women will respond to certain medications and things like that that are addressed in research. Also, certain life events such as pregnancy and menopause put women at a higher risk of cardiovascular disease. And interestingly enough, women usually develop heart disease an average of 10 years later than men do, but it's still our number one cause of death. And when it comes to maternal mortality, cardiovascular disease is really impactful because it is the number one killer of new moms, and it accounts for over 1/3 of maternal deaths. When it comes to Black women, the numbers are even more concerning. So, although cardiovascular disease is the number one killer of all women, Black women are the most affected. 59% of Black women ages 20 and over are living with some form of cardiovascular disease. That is compared to all women at 45%. Black women also have the highest prevalence of high blood pressure at 57%, which is more than any other race or ethnicity. Black women are also more likely to have undiagnosed type 2 diabetes, which is a risk factor, as we spoke about before. The prevalence of stroke for Black women is 2 times higher than that of white women. Black women are also more likely to die of heart disease and at younger ages than white women. So, why do we see a higher risk for Black women to develop cardiovascular disease? Well, the answer isn't simple. There are many factors that contribute to this. However, we do see higher rates of high blood pressure, obesity, diabetes, physical inactivity, and chronic stress among Black women. And that is probably due to a lot of things that are in place structurally. So things like racism, sexism, and other forms of discrimination in healthcare, employment, income, education, housing, food access, the justice system, the list goes on. Moving on to how women experience certain cardiovascular diseases differently. The signs of a heart attack in women may look different than what we have traditionally been taught. So, just like men, women's most common heart attack symptom is chest pain. But women may also have other symptoms that people wouldn't normally think about when it comes to having a heart attack, such as anxiety, shortness of breath, nausea, vomiting, an upset stomach, pain in the shoulder, back, arm, or even jaw, unusual tiredness, and or weakness. So we have been trained to think that tightness in the chest and chest pain is the only thing that indicates that we're having a heart attack, but women also should look for these other symptoms if they're experiencing them. But there is good news. So although there are some things that are outside the locus of our control, we do have control over our own health behaviors. So if you want to reduce your risk for cardiovascular disease, you should learn to reduce and manage your stressors that you have daily. You should really try to fuel your body with nutritious food, a balanced diet, keeping in mind levels of sodium and saturated fat, staying active, getting enough sleep, good quality sleep, managing health conditions. So making sure you know your numbers, monitor your weight, blood pressure, blood sugar, and cholesterol, making sure that you don't smoke, or if you do smoke, trying to reduce your smoking habit or quit. Next is knowing your family history. If you know that you have a history of cardiovascular disease in your family, you can be proactive. And the last thing is advocating for yourself, making sure that you are working with your physician to be sure that you are doing everything that you need to do to maintain cardiovascular health and get any kind of testing that you may need if you feel, especially if you have that family history. So being able to talk to your doctor and create a plan together. And here at CWUW, we absolutely recognize that developing those positive health behaviors and knowing your numbers can really help you reduce your risk for cardiovascular disease. So our program, Sisters Together, Move More, Eat Better, is our longest running program. Sisters Together provides online and in-person programming for organizations, neighborhoods, and the greater Indianapolis community with a focus on women, especially Black women's whole health. We focus on self-monitoring for blood pressure and blood sugar, and we provide a way for women to come together and help to support each other in their wellness journeys. So Sisters Together is a way for you, if you have those health goals and you think that it would help that you had a little bit of social support, some accountability, you should enroll in Sisters Together so that we can work together towards your health goals. Luckily, we have lots of great events coming up so that you can get to know us here at Sisters Together. First, we have our monthly community-wide walk that's going to be happening at Frederick Douglass Park Family Center, the indoor track, this upcoming Saturday, February 22nd at noon. Next, we are going to be doing a CWUW departmental collaboration March 12th. That is a Wednesday night at 6 p.m. We are going to be combining movement and mindfulness. So that is usually our coloring and conversations evening. We are going to be adding a little bit of Zumba during that evening so that people can come, move their bodies, and then can sit down, engage in some mindful activities and mindful adult coloring, and have a really good conversation together. So we hope you join us for that. Next, we are having our Eastside neighborhood walks. They will be beginning in March. Grassy Creek every other Saturday at 9 a.m. and Frederick Douglass weekly on Wednesdays at 6 p.m. Next, if you missed our Spring into Action 90-day challenge that's happening right now, we have another challenge coming up for the summer. It's going to be happening June through August. More information to come on how to sign up for that. Also, if you did sign up for the Spring into Action 90-day challenge and was not able to participate, you will be receiving an invitation for our summer challenge as well. If you have any more questions about Sisters Together programming, what we do, please go onto our website, take a look. That's cwonline.org/Sisters Together. You can also check out our Facebook group, Sisters Together Facebook group. There are lots of folks in there, and we love to see folks in there letting everybody know how they're moving more, how they're eating better, and connecting with each other to provide that support that everybody needs during their wellness journey. Thank you so much for tuning in to Wellness Wednesday this week. We hope you learned something new about women's heart health. We hope to see you out at one of our events, especially our Sisters Together Move More, Eat Better events, so that we can all work on our heart health together. And we hope to see you at Wellness Wednesday next week. Thanks, y'all.